According to the latest UNAIDS and Uganda AIDS Commission statistics released in July 2019, 28,000 people died of HIV/AIDS and 50,000 new HIV infections were registered in 2018 in Uganda. The report indicates 1,000 infections every week, translating into 143 infections per day. Women are disproportionately affected, with 8.8% of adult women living with HIV compared to 4.3% of men. The estimated HIV prevalence among adults aged 15 to 49 stands at 5.9%. One such community that is devastated by HIV/AIDS are the neighboring small villages of Masaka and Kitugutu, found in Chenjojo district in western Uganda. There are approximately 2,500 people living in this community. These villages are remote, isolated, and hard to reach. The easiest means of transport in these villages is by motorcycles. However, in some areas, because of the terrain, walking is a must. Bedridden patients and expectant mothers in labor are transported using locally improvised stretcher ambulances made of papyrus material and wood. The community here is devastated by HIV/AIDS. According to the information from the village health teams, an estimated 200 people are living with the disease and are not on many medication. At least one requires 20,000 Uganda shillings, which is equivalent to $5 per week, for transport to pick free ARV drugs from Chembogo Holy Cross Health Center 3 or Chiarusozi Health Center 4, which are 40 kilometers away. None of the patients can afford this cost.
So you find somebody coming from Kitugutu to this place is like 25 to 30 kilometers. Again, you add the 30 kilometers from here to Chiarusozi, going to collect drugs. Sometimes these people tend to drop out.
Many of the patients are killed by the opportunist infections because they are not on any medication. They default on recommended daily medication. Strong ARV drug effects, hunger, and general body weaknesses are some of the reasons why some patients tend to default on medication and die.
Nosanga omuntu n'abalukubi kandi ali hamibazi yegyo na yetagisa kuija obwire bwo buhikiro bwo kuija hanu kuija gitabara hanyuma bwarukuba ateine transport yo kumuhicha hanu obundi nasanga ina munkaka suija ateke kiro kikire nalema kuija koraki kuija kugitabara ekyo nikimutalibaniza abo kuba narugira hara kandi obwaru kuija hanu akatabara emibazi yegyo nosanga naba nayitaga kulya kurungi hanyuma kulya kurungi nosanga ebyokulya byakwetagisa kulya nosanga takozireki nabatabine.
The woman lying down here is 45 years old. She lost her husband 2 years ago to HIV/AIDS. She has helplessly been bedridden for 2 weeks without any medical attention. She is waiting for her day to die. We had to ensure that she's taken to the hospital, which is over 20 kilometers away, using the local stretcher ambulances over those hills and up to the point where a motorcycle could pick and drop her. It is a common sight to find children as young as 5 years nursing their sick parents on top of performing livelihood activities. Many of such children are at risk of sexual abuse like rape, early child sex and marriages, leading to early child pregnancies and spread of diseases. Many orphaned children here are under the care of their elderly grandparents who themselves look very old, helpless, and frail. They cannot provide for the orphans effectively. This makes them vulnerable to hunger and suffering as they struggle to meet their medical and feeding needs. Some of these orphans were born with and are living with HIV and are not on any medication. Some are stunted. This woman is a 65-year-old widow suffering from HIV. She lost her husband to HIV 10 years ago. She's looking after her 8-year-old grandchildren who are twins. Sadly, one twin is HIV positive and the other twin is HIV negative. Their mother lost the battle to the HIV/AIDS scourge when they were only 3 years old. Their father abandoned them and disappeared from the village. A similar story is told by this 90-year-old man who is HIV positive. His wife is 80 years old but HIV negative. Together, they are looking after 6 orphaned grandchildren whose parents died of HIV/AIDS. There are so many cases like this, and even worse ones in this underserved community. The people here are devastated by the disease and are in dire need of help. There is urgent need for resources in whatever form, so as to bring the most needed integrated health services and products closer to this community. Hi, I'm Dr. Alice, the co-founder and promoter of Rescue Food Project. As a non-government organization, we pursue a mission of empowering vulnerable and poor communities with essential knowledge and sustainable interventions for improved socio-economic outcomes. I am inviting you to partner with us today so as to save and transform the lives of children and mothers in Masaka and Kitugutu villages. For more information on how you can get involved, please write to us on info@rescuefoodproject.org. To partner or donate towards this cause, please visit our website www.rescuefoodproject.org and click on the donation and partnership pages. You can also connect with us through our social media platforms on the website or sign in for our monthly newsletter. We will be glad to hear from you.